Vanakkam, good morning. In this video, we are going to discuss about the regulation of salivary secretion. Regulation of the salivary secretion. In the cephalic phase, it is mainly controlled by the higher centers like cerebral cortex. So, in the cephalic phase, the salivary secretion is stimulated by the sight. When we are seeing the food or smell the food, it is stimulate the higher center, it increases the salivary secretion. So it is a conditioned reflex. We already trained with the response. When we see the same food, so our salivary secretion is increased. When we are seeing the biryani, automatically saliva is increased. This is the conditioned reflex. Sight or smell of the food is stimulate the cephalic phase. And focal phase, when we are taking the food in the mouth, it is stimulate the receptors that send the impulse to the medulla. It stimulate the 9th and 7th cranial nerve, stimulate the salivary secretion. This is the unconditioned reflex. And when the food is travel through the esophagus, it is also stimulate the salivary gland to produce some amount of the saliva. Like that, when the food in the stomach also stimulate little bit amount of the saliva, and when the food in the intestine also stimulate the minute amount of the salivary secretion. Parasympathetic innervation of the salivary gland. The parotid gland receives the supply from the 9th cranial nerve nuclei from the inferior salivary nucleus of the medulla through the tympanic nerve, tympanic plexus, otic ganglion, through the claustropharyngeal nerve supplies the parotid. The sublingual gland receives from the superior salivary nucleus through the facial nerve, 7th cranial nerve, through the nervus intermedius, cauda-tympani nerve, it receives the facial nerve supply. The smell sensation is supplies to the higher center. This also stimulate the salivary secretions. And the taste sensation from the anterior 2/3 is carried by the facial nerve, posterior 1/3 is carried by the claustropharyngeal nerve. The parasympathetic innervation is important for the salivary secretions through the conditioned reflex. The sight and smell increases the salivary secretions through the conditioned reflex through the stimulation of the higher centers of the brain like cortex. It increases the secretion the parotid, submandibular, sublingual glands. The unconditioned reflexes due to the stimulation of the receptors present in the buccal mucosa. When the taste receptor, when the food is touched with the mechanoreceptors present in the mouth, esophagus or stomach intestine, that send the impulse to the afferent, especially from the mouth through the afferent nerve, carries to the center of the nucleus located in the medulla, inferior salivary nucleus, superior salivary nucleus. The taste sensation, chemoreceptor also supplies to the higher center, and the efferent is via the 9th and 7th cranial nerve, increases the salivary secretion from the parotid, submandibular, sublingual glands. Sympathetic stimulation decreases the salivary secretion. The sympathetic supply from the T1, T2 segment of the spinal cord to reach the superior cervical ganglion through the paravertebral sympathetic chain. The postganglionic fibers travels along the carotid artery fibers to reach the salivary gland. So the stimulation of the sympathetic system decreases the salivary secretion. Thank you for watching this video. If you like this video, share your friends. Those who are not subscribed this channel, please subscribe. Thank you once again.